Okay, we'll try again. If you pay particular attention on this slide to all of the municipalities that you see in red, those are currently municipalities within the county that have an infant mortality rate of 13.6 or greater. And our goal is 4.5 or less. So we have particularly a long way to go in terms of reversing the infant mortality trend from a county perspective. We could give you a whole separate lecture and a whole different discussion, but we can actually show that some of what we're facing now is because of banking and housing practices back in the 1930s. So if you were to overlay other things related to the county, related to redlining or poverty or chronic disease rates for adults, they're all falling within these particular communities within the county. If you take a deeper dive into the city of Cleveland, you'll note that there are 2 neighborhoods that are currently in red. They have infant mortality rates that are 4 times the national average. Again, these are particularly predominantly African American communities where we see a lot of these issues happening around infant mortality. And there's some other targeted work through the Ohio Equity Institute for Birth Outcomes in the county that is particularly focusing on the Lee Seville area and looking at a few social determinants of health related to infant mortality, in particular family planning and looking at group prenatal care. So produce prescription is really addressing a different social determinant of health countywide to try to address infant mortality on a larger scale. And kind of how the stars all align with this. So Cleveland City Council had actually seen the idea of a produce prescription program in similar parts of the country. In particular, there was a program out in Michigan. And through conversations with the local food policy coalition, we looked at that model in addition to a number of other prescription models across the country, particularly through a national partner called Wholesome Wave, who works with the local food policy coalition on a number of initiatives, including our farmers market incentive program. And so really it was through the Food Policy Coalition in Morgan who kind of convened public health partners upstairs on the 4th floor and the hospital systems to talk about, is this something that we could do in Cuyahoga County? And what would that look like, and how could we make that look? And really leverage some of the things that we are doing on. So to review, for those of you who may not know about the great work going on within the farmers markets, we've seen tremendous growth in the number of farmers markets locally over the past decade. The majority of them are independently managed, and they also participate in the Produce Perks program. So Produce Perks is a SNAP incentive program where a participant can go and use their EBT or food stamp card and swipe for $10 on their EBT card, and then the Produce Perks program will match that dollar for dollar. So a participant could receive up to $20 to then go spend on fruits and vegetables at the farmers market. In 2014, we had 21 farmers markets in the county that accepted SNAP and offered the Produce Perks incentive program. And when you think about integrating into infrastructure, one of the great things about this is the farmers markets use common currency, they all use tokens, they are all collecting data in the same way, so they're all being evaluated the same way, and they all use very similar marketing materials. So as you'll see this unfold, we were very intentional about designing this program to fit into what was already going on. So this didn't become another thing that we were asking somebody to do and then had to do the sales pitch to try to convince them why this was important. So this just goes to show you some of the different experiences at the market. So as I mentioned, you swipe for tokens, and then the other really great thing, and we'll talk about it as well, is these tokens can be used at any vendor. So customers can feel comfortable going up to anybody and just spending the tokens like they would cash. At the same time, for those of you that are familiar with the peer project program here at the PRC, I was participating, Jackie's shaking her head. I was participating in the project as a fellow, and the goal of the program is to increase the community, the research capacity of community-based organizations. And because I'm a dietitian by trade, and at the time I was somewhat new to the maternal child health world, particularly the maternal side of it at the agency, I decided to do my project on looking at food access and birth outcomes in the county, particularly preterm births. And does it impact our preterm birth rates? Because if you were to look at the top 3 causes of our infant mortality rates in the county, prematurity is number 1. And we know that a lot of the babies that are being born prematurely are being born into poverty. So I was really interested in looking at this connection. And as I embarked on this process, I was really kind of wowed to find that we found one article that actually tried to make this connection. There's hosts of articles and literature on looking at micro and macronutrient consumption and its effect on pregnancy. Is mom getting enough vitamin C? Is she getting enough vitamin D? Nobody ever thought to ask, can she get those foods that give her vitamin C or vitamin D or any of those other things? So what we did was we looked at 2010 birth outcomes within the county. And then I also undertook a GIS project where I used healthy retail food data that we had. So I was looking at small and large grocery stores, setting a half-mile buffer around each of the stores, plotting the births, and then for any of the births that fell within the buffer, mom was considered to have healthy food access. Any of the births that fell out of the buffer, mom was considered to live in a food desert. And we were able to conclude that 15% of our preterm births in 2010 happened to moms who lived in a food desert. And that was as much of a risk as any other risk factor when you look at preterm birth. Educational level, tobacco use, race, it mattered just as much. So this is how the stars kind of all kept starting to align for this project. And then again, it was really about the partnerships. So from the Board of Health's perspective, we administer the Child and Family Health Services grant. This is a grant where part of what we do is we contract with providers who offer prenatal care to low-income pregnant women in hopes to improve birth outcomes. We also fund a very large home visiting program that is focused within East Cleveland and Warrensville Heights, where we have community health workers going out into the home twice a month until the baby, prenatally through the baby's 2nd birthday. And so, we had people we were already paying to go into these communities and reach these women and provide services. So we said, we can just integrate this into our grant work and what they, are already doing for us. And then we had our partners at OSU Extension, and not only do they convene the Cleveland-Cuyahoga County Food Policy Coalition, they are the ones that have the extremely strong relationship with the Farmers Market Network. Again, it just seemed like a natural fit. The Food Policy Coalition has worked with the markets to accept SNAP and EBT and offer the Produce Perks program. So we said, hey, can we design this project to be very similar to Produce Perks? It's just a different voucher, a different way that clients go to get the tokens. Otherwise, the infrastructure for the most part already existed. And then we had our partners here at the PRC who really, although we were just joking, Erika kind of left us high and dry because she went and had a baby. But really from the program development and implementation and evaluation perspective has been really critical in kind of providing that research lens and effective evaluation so that we could demonstrate our outcomes and impacts. So the Produce Prescription Program, again, this is for the 2013 program year, so this was our pilot year. We were out to say, does this work? Could this work? So this is the overview of the project. We provide education through a host of different mechanisms, recipe cards, marketing materials for farmers markets, cookbooks, how to shop at markets, what to buy in season. We work with participants on goal setting to increase consumption of fruits and vegetables. We provide them a physical prescription to go shop at the farmers market, and then we provide them some additional promotional items to help support, when they bring this food home, tools that will help them use it. So again, it's a partnership between farmers markets, public health, and academia, and our goal is to increase fruit and vegetable consumption in pregnant women through shopping at a farmers market and really showing them that this could be an additional outlet where they purchase food, because we know a lot of them are living in communities where grocery stores are not nearby. So how it works, at each monthly visit, participants set goals to increase fruit and vegetable consumption. They receive 4 $10 vouchers, which can be redeemed at any of the 21 markets that participate in Produce Perks for fruits and vegetables, and then they receive additional items to support eating at home. And we run the program through the market season, so this program runs July 1st through October 31st. So this is what to show you what the prescription looks like. I laughed because when Dr. Frieden was here, and we were telling him about this, he goes, "Wait, you write them a prescription?" And it just was funny to me from a physician, like, yes, we write on a prescription pad, go eat fruits and vegetables, and we hand it to them. So seeing his reaction to that was kind of funny. But what it looks like at the top is when the provider is working with the client, they go through the reasons that they're prescribing the prescription for the client, and then they also work on goal setting. So they can check as many of these as are applicable to the client for that month. And then they get the 4 vouchers. The vouchers can be used all at once. They can use them weekly. They can choose to use them 2 at a time. It's really up to the client how they use them. They're also used in addition to any other incentives or cash that they choose to use. So this is really in addition to anything else that they're either already using or eligible for. This is a copy of the seasonality chart that they get. We laminated this so that they could hang it on their fridge, use it at home. They would always have it handy. And from the provider side, we really asked them to use this to show the clients, you know, here's what you might find at the or expect to find at the market this month. We also created this handout, how to shop at a farmer's market, because as you'll see in a little bit, many of these women have never been to a market, don't know how to shop there, didn't know they were around them. So we tried to make them comfortable what they could expect when they got there. So that's the front and back of how that looks. And again, this was laminated so that they could use it on multiple occasions. This is a copy of the produce prescription card. So this showed them on a map where all of the markets were that they could redeem their vouchers for. So how the program is set up is we have different provider sites. So for the 2013 year, we use a traditional prenatal clinic as one of our sites. So when the participants were going to the traditional site, they could have been seeing a physician, a nurse practitioner, or the WIC dietitian who were all within the same practice. We also partnered with a centering pregnancy program. So these were women that were receiving group prenatal care and were generally working with a nurse practitioner and a patient advocate during their sessions. And we had 2 home visiting programs. So participants in these programs are receiving this program through community health workers. So we had a couple of different ways in provider sites that the moms were potentially participating in. For the 2013 year, women had to be less than 24 weeks pregnant to be eligible to participate. And our thought process behind that at the beginning was they would be pregnant for the entire market season. So we know that they would be going at least once a month for prenatal appointments. They would be able to receive their vouchers once a month, and then they would be able to use them throughout the entire season. We hoped that we would increase awareness and utilization of the farmers market network within the county. We wanted to increase knowledge of purchasing, preparing, storing, and using fresh fruits and vegetables. We were really looking to increase sales for local farmers markets, or farmers and producers, and we were also looking to improve client-provider communication around healthy eating and fruit and vegetable consumption. We had 3 different ways that we evaluated this. Through the participants, we had a baseline survey. They completed monthly surveys, and then we had a post-survey, and they were all used to assess consumption, their experience at the markets, barriers to shopping, and then eating the fruits or vegetables. From the provider end, we conducted post-interviews with all of them, and it turned out to be a rapid cycle quality improvement process. So we wanted to know from them, before we designed, or made alterations to the program, what worked, what didn't work, what was their experience, how could we improve this to increase participation for the following year. And then again with the market managers, they were the ones collecting the vouchers, which all had a participant ID assigned to them. So through their monthly reporting, we were getting, participant 1301 redeemed X vouchers this month, totaling this amount. So that we had 3 different layers of evaluation that way. Before I trip. Okay. So I'm Erika Trapl, and I'm going to present our results. Before I jump into the results, I want to mention one thing that we probably haven't said, which is that this really, for our first year, was a feasibility study. It was the idea of, could we actually do this? So we weren't doing gold standard dietary change measures. We were really looking to see, is this even feasible? And could we even get this off the ground? I should also give us a little bit of credit too, because I think we started these conversations in March of 2013 and actually trained providers in June of 2013 and had that program live by July while I was on maternity leave. So we were, even just getting that launched was a success for us. But we do have some results that I think we were excited about for our first year. Okay. So this is just a description of our sample of the moms who participated. So we had an average age of about 24, and they ranged from 15 to 35. A majority of the moms were African American, and about a little over a third, this was their first pregnancy, and about a third had 1 child already at home, and just over a quarter had 2 children at home already. You'll see a spread in educational attainment, with the majority, though, having high school or less. And so this is pretty representative of the population that's served by the CFHS program. What we were also interested in were these baseline experiences. So what we thought was really reaffirming is that even at baseline, 90% of the moms felt that fruit and vegetables were important for having a healthy baby. So there wasn't anything we really needed to change there. They already knew the baseline importance of a healthy diet. What we were also interested to see, though, is that over 60% had actually never been to a farmer's market, despite the fact that 78% said that they lived near one. So there was a real opportunity through this program to connect moms to an asset that they already identified as being right in their community. One of the things that we were looking at was to see how many program visits mom was able to attend, and then we broke that down into proportion. Some moms did have their babies early, and some moms started the program a little bit late. So we wanted to look to see program exposure. So you can see there was kind of a range of number of sessions, which might play out in redemption. But there were a number of moms who kept a substantial portion of their appointments. When we looked at the redemption data, what we saw was that 56% of the moms redeemed at least 1 voucher. So more than half of our moms redeemed at least 1 voucher. When they did redeem, what we saw was that about those moms who redeemed vouchers redeemed on average over $75. So if they got the full number of vouchers, they could have redeemed up to $160. So it's $40 a month for 4 months. On average, they were redeeming about half of that amount, but that really ranged from 40 to 120. We conducted some post-program surveys, and as Alison mentioned, we engaged moms who were earlier than 24 weeks so they could make it through the market season, but a number of those moms had their babies, and so we were not consistently able to follow up. So we only had about 40 participants who participated in our post-test survey. Of those, however, we were pleased to see that there was high endorsement of the usefulness of the materials that we gave them, the recipe cards, the season guide, and the farmer's market guide. And that 63% felt that eating fruits and vegetables was more important because of the produce prescription program. And 86% said, I visit farmers markets more now than before the program. So again, self-report, but some strong evidence of at least raising some awareness about the importance of the markets and fruits and vegetables. In looking at the post, most moms said that they were beginning to take steps to eat more fruits and vegetables every day, about 44%. There were already 28% who said that they were eating at least half a plate. So we considered this at least an optimistic measure of a healthier diet. 58% of moms did indicate that they were eating more fruits and vegetables based on their self-report, both an increased number of fruits eaten at post-test and an increased number of vegetables eaten at post-test. And of those moms who did report eating more, 64% redeemed vouchers. Okay. When we talked with the providers, and when we also looked at the report back about some open-ended items about why moms didn't go to the markets, many of them said transportation, access to transportation. I didn't have a way to get there. Others indicated something that perhaps was an access to the market. So markets may have been near them, but they may not have been open when mom could get there. So while it was physically close, the availability or the access during the time of the day, and if any of you are familiar with farmers markets, you know they're typically open 1 day a week for a period of time, or some a couple of days at most, but they're not open like a store would be. There were also a couple of minor negative market experiences with the market manager. So a few moms reported that when they went to redeem their voucher, the market manager wasn't willing to redeem the voucher, and there were some misunderstandings about the program that really gave that mom a negative experience. I will say anecdotally, and I think this might come up later, fortunately, a number of those moms who had the bad experience were in the centering pregnancy group, and so they went back to their centering group, shared that negative experience in the centering group, and said, I went to do this and I had this really bad experience. And other moms in the group did what these centering groups are meant to do and provided that social support to say, you know, you may have had a bad experience at this market, but I went to this market over here and it was wonderful, and I really think you should try it again. And as we understand, that mom did go back, had a much more positive experience, and so was able to continue through. But that gave us also the opportunity to retrain as needed with those market managers to ensure a more positive experience going forward. We also wanted to talk with the providers because they were really our link to the program. We trained the providers to implement. We were really most concerned about their ability to integrate their program into their service delivery. We know that providers these days have limited time with their clients, and so we wanted to make sure that the program that we had created was of value to them as providers, and that they perceived it as something that was valuable to their clients. We were also thinking that in this first year, we engaged 75 moms, and we were thinking if we wanted to implement it in 2014, we wanted to be thinking about what we might need to change or modify in a very rapid way so that we would be ready for the 2014 season. So beginning in February of 2014, we began an interview project with all of the providers to kind of assess these domains of implementing that you see on the left-hand side. So our research team, our collaborative group, came up with an interview guide that looked at the categories and the framework on the left-hand side: role of providers, characteristics of the participant population, the produce prescription provider training, selection of participants, introducing the program to participants, follow-up, data collection opportunities, and patient-provider interaction. We walked through a pretty standard qualitative analytic process of doing some deductive coding on those interviews, coding them under categories, grouping similar codes, and then identifying some major themes, which I'll present. So we saw 3 major themes really emerge from the providers. The first was the characterizing food choices of participants and thinking about the participant experience. The second was the challenges and opportunities of the program itself. And the third was the opportunity for patient-provider interaction. And I'll give you a little bit more information about each, because it really is the quotes that are most interesting in some of this work. So first, the providers really told us more about who they perceive as their clients and the food choices of their clients. And so in this quote, the provider is telling us about one of the clients she had seen just that day who ate a lot of fast food, had cut her energy drink consumption down during her pregnancy, right? From 3 Monster energy drinks to only 2 extra large sweet teas from McDonald's. But she does like fruits, so she eats bananas or grapes occasionally. So this was a very common description of the diet dietary habits of the participants as observed and perceived by the providers. So this kind of set the frame to them of saying this is a program that would be valuable. They talked about convenience and habit being influencing factors for their moms. They eat fast food, chips, those 50-cent juices. They eat what they can get their hands on. They either don't like them or vegetables are too expensive. So they've never heard of farmers markets, never excited them because they think they're very expensive. Or habit. It's because they've been brought up that way, and once the parent lets them constantly have processed food, they get used to it. Again, provider perception of their clients' eating habits, but it gives some context. They also talked about access to fresh produce versus fast food. As Alison mentioned earlier, there are a number of food desert neighborhoods, right, in the city of Cleveland and where these moms live. The community we work in only has fast food joints lined up, but grocery stores are far out. Although we have this farmers market right in the area, which is a good thing, but that's the only one. There were a couple of challenges, and I mentioned this one already, navigating the farmers market. There were a few instances where farmers market didn't accept the voucher. But again, that group model was the most conducive to kind of bouncing back and encouraging another try through that peer support. There was a lot of conversation around what did you get, where did you go when these groups came together, the centering groups. So the program fostered that conversation around this behavior and began to normalize it within the context of that group experience. A barrier and a challenge that was also experienced was that we had restricted enrollment to English-speaking population in the first years, mainly because we didn't have the time really to get everything translated and to move it into the Spanish-speaking population. We worked with a site on the west side that expressed a lot of interest in getting the translated materials for their Spanish-speaking population. There was also concern and a lot of questions back to us as the designers about why we limited the program to moms who are less than 24 weeks pregnant. To us, that made a lot of logical sense, right? Well, we want to maximize exposure to the full market season. But for these providers, they said, all of my pregnant moms need this program. All of my moms need this program, not just the ones who are in this little window of pregnancy. And that was important for us to hear. We asked the providers about training. They felt that it was self-explanatory, but the need expressed to elaborate the training process as far as how to track. We have a system to know which one is enrolled, but it's hard to know when they're coming and which week it is that they're due for their coupons. So this was more about implementation and how we could provide some more programmatic parameters around that. Evaluation of the fruit and vegetable goals wasn't happening. We realized that in the design of the program, we had made some assumptions about revisiting the previous month's prescription and to see if those goals were happening. But as the providers implemented, we realized we hadn't naturally built in the place in the conversation to revisit that previous month. So that was really helpful to hear that although we thought that would happen, that wasn't always happening in the follow-up visit, and provided another potential opportunity for us to increase those redemption rates. Finally, awareness about the farmers market. PRx absolutely encouraged them to go. My favorite story is the couple who went to the farmers market and got blueberries, and their 6-year-old had never tasted a blueberry. She told me she was going crazy eating these blueberries. So this was something else that came out for us, is that we had thought that this was about the pregnant woman, but we hadn't really thought about the broader implications on her family and the children that she already had and how this might begin to really impact the larger family context. That it wasn't just about this pregnant woman, but about all of those in her family. So we found this to be a very valuable comment. Again, there was a comment on exposure to new shopping habits. The moms couldn't believe how much they could get at the farmers market with their $10 or $40. So there were some preconceived notions about cost at the farmers market. These vouchers gave them a no-risk opportunity to go and experience the farmers market. What could they buy with these $40 in vouchers that we were giving them that were of no risk out of their own very valuable SNAP dollars? And that came out in the second. They could not think about the limited food stamps that they had, and one, they needed to buy other stuff too. So this was money that was set aside just for fruits and vegetables. Another group got to talking about taste, how they taste different when they're in season and not in season, and how things are cheaper in the grocery store than when they're in season versus not. So this was another important aspect, and often what goes into some of this farmers market nutrition education is that even in grocery stores, when food is in season, it's less expensive. If you have that chart, you can refer back, you can begin to perhaps manage your purchases and the dollars and think a little bit differently about how you engage with that farmers market. What we also wanted to do was increase awareness of other food incentive or food support programs. So surprisingly, not all of our moms were already enrolled in WIC, nor were they all enrolled in SNAP already. And if they were, there wasn't always awareness of the SNAP incentive program, Produce Perks, that's already in existence. So it was an opportunity, again, to not only introduce them through PRx, but to educate them about the other programs that they were eligible for. The providers really felt that this was, as they say, a beautiful partnership. We would agree. And that anecdotally, again, while the moms were at the farmers market cashing in their vouchers, they also would be eager to spend their SNAP dollars. So if they wanted more than the $40 that they had or the $10 that they had brought that day, they would use their SNAP through the Produce Perks and get that met. Just a few more of these. The providers also mentioned the opportunity for frequent nutrition education. They felt that it was more consistent conversation around healthy eating. The goal setting helped in identifying deficits in whole food consumption. They could talk about the colorful diet, and it really supported those conversations in an additional way to emphasize nutrition. So they had their standard nutrition lessons that they, that they always delivered, but this gave them more of a focus around fruits and vegetables. One provider said it was fun talking to them with a motive, and they thought that they were perhaps more receptive because it was in the context of this produce prescription. What we weren't also expecting was that there were some benefits for the provider, and one of those was that they then felt like a little bit more of an authority in advice, that they had this information, they were advising, and they really had the materials to be serious, as this provider says. I'm very serious about this. Go and do this. This isn't just fluff. It's not information. I'm giving you some tools to go and act on this advice. They felt that there were improved relations, that it got them more interested in talking about diet. In some cases, got moms to even come back for their next visit because they were looking forward to their next voucher. Because our primary point of information gathering were the provider interviews to some extent, on top of that participant data, we could put those together and have a better understanding of how the program really rolled out in the 2013 year, what we might do differently. And prior to our new launch, we brought the providers back together and wanted to share with them that we heard them. We felt it was really important that this was a very engaged process. And what we heard loud and clear was that we needed to plan a comprehensive training curriculum for the providers. We needed to help them with the tracking and follow-up system, so that really became part of the program that they could modify and implement in their own way. We wanted to strengthen the counseling skills so that they were reviewing the previous month's goal at each session, and then really increase those connections between SNAP and WIC. We wanted to, we heard them say to widen the eligibility criteria to include postpartum mothers and their children. In these home visit programs, they typically start from pregnancy through age 2. And it was especially those programs who said these are the moms who could also use. There's also a movement to extend the centering pregnancy programs into centering family or parenting programs. So those were other groups that said, we'll see these moms. This is another opportunity to really extend that message of healthy eating and healthy diets through the first years of life. And then we heard them say loud and clear to create the Spanish language materials, which we acted on for the 2014. So I'm going to hand it over to Morgan to talk more about our expansion for the 2014 season.
You going to pin a rose on me? Thank you. Okay.
Hi, everyone.
Hi.
Good afternoon. I'm Morgan Taggart. I work for Ohio State University Extension and the Food Policy Coalition, and I'm going to talk in a little bit more detail about what the changes that we made last year to the PRx. And I will say, we had our meeting, May last year? Was it April? And we had done, all of these kind of debriefs with all the providers and getting their feedback, and then they saw us kind of roll out what the 2014 program was going to look like. And I remember they all said, you actually listened to us, you made the changes that we recommended in all these provider interviews, and we're kind of seeing some of the changes that Erika was talking about in terms of feedback, eligibility criteria. So when we looked at the 2014 program, they said they had more women that really wanted to take advantage of it. And through the support of several local funders, we were able to expand capacity and include 200 participants instead of the usual 75 that we had back in 2013. We also, as you can see, widened our eligibility criteria, so as long as they had a child in the home less than 18 months, they could participate. One of the other challenges that we had in 2013 was it was kind of a rolling enrollment period, which made, from the program administration side, a little bit more challenging, bringing people on, because we wanted to be inclusive. If you want to do this, we want to bring you in, but the program got a little bit more complicated because we were taking folks into the program for a longer period of time. In 2014, we defined that enrollment period from July 1st to August 15th, so we had a 6-week period in which we were enrolling moms in the program. We also got some feedback that our wonderful research tools were way too long. For those researchers in the room or people doing programs, you dream up all these great questions you want to ask. You're like, I have a captive audience. I can ask them any question I want to. And then you end up with 50 questions, and then they do the first 5 and are just kind of done with it. So we really took the red marker to all of our questions, shortened them up, made them simpler, and really tried to focus in on what those questions were that we wanted to ask to be sure we were getting the data we needed to make the most impactful program we could. We also, because of our extra funding, were able to translate all of our materials into Spanish. So for some of our programs and provider partners, that was a really key piece for them to be able to recruit more broadly. We also kind of restructured some of the visits, both the intake visit and the monthly visits, to make it more of a conversation. I'll show you one of the tools that we developed for that monthly check-in. So at the intake visit, the provider then would discuss with the client the opportunity to participate in this program. And if they were interested, they would do a questionnaire, not a baseline survey. We're just having a conversation. We're going to ask some questions. We wanted to learn about their experience with farmers markets, any barriers that they have accessing farmers markets and healthy food, and kind of what their current eating habits were. We also provided them with this information sheet that just kind of provided a basic framework of how the program worked. Who is eligible? What is this program actually about? How do I use it? How do I do it? What do I get out of it? Does it cost me anything? So we kind of tried to put down in very simple terms the general information about the program. We also had this intake questionnaire that I mentioned where we tried to keep the questions very brief, simple, and to the point. Questions about some general kind of nutrition information that they might have experienced through nutrition education program, from family, friends, and get some of their perceptions about eating healthy. We also had our voucher, and we did change up some of the reasons for prescribing and some of the goals as well in the sheet. We also have a raised, what do we call that thing? An embosser with the logo, because we heard from market managers, like, anyone could photocopy this thing. So I only helped Alison with the first round, but I definitely had a hand cramp because we would actually emboss each individual voucher, 200 every month. So we tried to do that to kind of help the market managers realize that, yeah, this is legit. This came from this program. Here are kind of a blow up of some of the different reasons for prescribing and also some of our patient goals. Yes, highlighted now, so you know where to look. Because we were expanding the kind of client population and participant population that we were working with, we had a brainstorm. Hey, these moms might have a kid in the home about a year old. What if we did some healthy baby food recipes? How can you pick up some really healthy fresh produce at the market and then turn it through some simple, easy steps into baby food? So we put together some tip sheets about how to do that, how to integrate some of that fresh produce with your young children. But then we also thought about how do we help people figure out, after they've been to the market, what do they do when they get home? Where do they put stuff? How do they store it? Do they wash it now? Do they wash it later? Do they put it on the counter? how can they maybe do some prep work when they first get home, chopping some of these vegetables so it's an easy grab and go from the fridge. Because we realized after that first pilot year that it wasn't just the moms that were eating the produce, it really was the entire family. So if the kids could go into the fridge and grab some cut carrots, awesome. So these are some of the recipes that we put together. And then again, we also translated all of these materials into Spanish as well. So we also redeveloped our kind of monthly survey into a check-in. And our thought was to really kind of restructure this more as a discussion between the provider and the participant in the program, not here's a survey, fill it out, get back to me in 10 minutes. Let's talk through what were some barriers. Did you shop this month? Did you go to a farmer's market? What types of things were you buying? Were there any challenges to getting to that market? So it really became an opportunity to share the kind of feedback from that program that month or their experience that month, but maybe also troubleshoot. Well, if that market in your community isn't at the right time, there might be another market in another neighborhood that might be relatively close to you. So it really kind of helped guide that conversation. This is kind of just a sample of what our monthly check-in looks like. See, very brief questions, only 5 questions on this side. We also really heard the providers in saying, how do we revisit these goals every month and see how they're doing? So this not only worked for the client and participant in the program, but the provider to kind of make sure they're checking in every month with those goals that they're setting on their prescription. And at the bottom, you'll see this question, if you did not visit a farmer's market last month, help us understand some of the reasons that kept you from shopping there. We're hoping to learn from them kind of what those barriers are, in addition to transportation or access issues when it comes to kind of spatial, temporal issues. Kind of what are those barriers that we're not seeing, that we don't understand, that we might be able to address in 2015 or 2016. We also provided some really fun little incentives with each visit every month. And these were different things to kind of help support consumption of fresh fruits and vegetables. Everything from a shopping bag, which there's plenty of. I think we'll be able to give those out for the next decade or so. A really great cookbook that we actually use at Extension for our FNET program that provides some very simple, quick, easy recipes that I can actually pass this around if anyone wants to take a look. And then we also provided things like a peeler, scrub brush, cutting board, little snack containers, so when you cut up those apples or carrots, they're in a little container to go. All of this to kind of keep things fun, help them, give them some very simple tools to increasing fresh fruit and veg consumption. So at the end of the season in October and into the fall, we had them complete this end of season questionnaire to kind of address their experience in the market, who actually ate the food that was consumed in the household, how they were prepared food. And this is just kind of a summary of the actual end of season questionnaire that we used. We also revisited some of the questions about fruits and vegetables that we asked in the intake questionnaire, not the pre-survey, the intake questionnaire, to just check, did any of their attitudes change? Did they, through these monthly visits with their providers, did they learn any additional information about healthy diets and eating fresh fruits and vegetables? So in terms of kind of where do we take this from here? We have a couple of different things in the hopper. Having learned so much from our pilot program in 2013, we're just beginning to look at the data from 2014. We've looked at some of our initial kind of snapshot, but we have a lot of surveys and questionnaires to work through. But there's a brand new opportunity out from USDA to really support these types of incentive programs at farmers markets for the first time, and that came out last fall. And our network of markets here applied in conjunction with Wholesome Wave, and those particular dollars will be able to support incentive programs like Produce Prescription. We also had the opportunity to partner with HIPC and the Board of Health and several other partners, including the PRC, to expand PRx to patients with hypertension. And that is just kind of in the beginning phases. We received the notification of award back in the fall, and we're just kind of gearing up and planning for what that might look like in 2015, 16, and 17. We're really hoping to take some of the lessons learned from working with PRx and pregnant women, and how do we transfer that to chronic disease management, and what does that look like? We've also had a lot of other discussions with farmers markets across Ohio. Back in September, there was a summit of markets from across the state that offer these incentive programs. And I just had a conversation with Columbus Public Health last week, who's really interested in doing a PRx program in Columbus. So there's also a lot of, I think, interest across the state in how do we expand these types of programs. And this really wouldn't be possible without all of our funders, in particular for maternal child health, but also our local funders here that really help us with materials development, translation, and the incentives themselves. So those come from St. Luke's Foundation, Mount Sinai, and George Gund Foundation. I also just want to kind of do a partner acknowledgement because I think this particular program really exemplifies the power of this partnership. I think we each had a very unique skill set to bring, and I think it kind of brought out the best in us and added value to something else that was already out there, which was this incredible network of farmers markets. And we have a couple market managers in the room. Would you please raise your hand? So we've got Broadway and we've got Gateway 105. And so both of these folks actually participated in the PRx program. And this wouldn't be possible without them. So I think in addition to funding, the partners that we have are really critical to the success of this program. And that's it. I think we're going to open up for questions. Yeah.
You mentioned at the beginning of the talk that one of the reasons for one of the goals was to increase farmers market, the success of the farmers markets. Do you have any indication if that helped a little bit, or is likely to help as the program is increasing?
We're just kind of beginning to take a look at the data for 2014. We know that with 50% of our folks, or 56%, were redeeming these vouchers. That's definitely money that's going to local producers that was not there before. I think the ability to amplify the impacts of this program by also connecting them with WIC, the WIC Farmers Market Nutrition Program, Produce Perks, and the SNAP Incentive Program, so people are able to take advantage of all of these, is really, really critical. And I don't know if the market managers think that these programs help the vendors and producers and the markets themselves. I'm seeing some nodding, seeing a maybe. But our goal is to really create more of a critical mass and a much more diverse customer base for all of these markets in Cleveland.
Oh boy.
How did you recruit these? How did you find what do you recruit them?
The question was, how do we recruit these participants?
The participants, so they were already participating in one of those sites. So they were either receiving prenatal care traditionally through a nurse practitioner or a physician. They were participating in centering pregnancy for prenatal care, or they were receiving prenatal care or postpartum home visiting through one of the two home visiting sites. So we left it up to the providers and said, you have X number of spots to enroll, offer to as many as you come in contact with until all your spots are filled. And then it was really up to the participant whether they agreed to participate or not. So that was kind of the beauty of leveraging the Child and Family Health Services grant, is because these services were already being provided, and it was up to the participant whether or not they wanted to participate. And if we had space for 3,000 women, we could serve 3,000 women.
Well, I just had a question as a manager, if there was a way of knowing sort of how many of these participants are in our area, or if, just more connecting us with them and them with us.
So, well, we do ask in the survey what's the nearest market to them and what the nearest intersection to their house is. So we know for the one provider site, those clients are specific to East Cleveland and Warrensville Heights, although they were predominantly all in East Cleveland. The other, that was one home visiting model. The other home visiting model was focused within the central neighborhood, but we know that those participants typically shop across the county and don't necessarily stick within the central neighborhood for their food purchases. And then for the Centering Pregnancy Program for 2013, that was typically they were on the west side, Gordon Square area, but again, those moms could have come from anywhere. And then with a traditional prenatal clinic, those moms were anywhere across the county that went to that particular clinic for services. So,
I have one more thing.
Yeah.
One thing we also did for 2014, I know you're asking about connecting the participants, but we actually did field trips with the providers and took the providers to the markets and showed them what the redemption process would look like so that they would be better positioned to explain that process to their participants and kind of demystify it as well. What is it like to turn in your voucher? What is it like to get these tokens? And I think that was really a very positive experience for the providers who did do those market field trips.
We also have the opportunity to do that this year, 2015, yes, with the participants themselves. So we were able to get a grant that would cover transportation to markets to do a participant field trip. So not only with the providers, but we can take a group of moms to the market, kind of walk them through the process, introduce them to the manager, the market staff, the customer booth, some of the vendors, to really kind of create any kind of barriers of, I haven't been, you know, when I go somewhere I haven't been before, I'm like, okay, who are these people? What are they doing? So to kind of break down some of those barriers and make it like, oh, this place is cool. My kids can do a craft. I can get something to eat. I can buy some produce. I can do some yoga. I can meet my neighbors. So we're trying to kind of figure out ways to break down maybe some of those kind of perceived barriers when it comes to farmers markets for first-time customers. Veronica, yeah.
Question and comment. Question. Did you, when you were researching initially, find any kind of data that was preconception versus prenatal having to do with? No. Okay. Just curious because that's
we didn't necessarily look at it from that angle initially because our pilot year was focused specifically on pregnancy. So.
But your 214 may, huh? Because some of those women could, in fact, become pregnant.
Correct. So that's actually one of the suggestions I've had to add to the survey is, did you participate in PRx last year? Because we know we have at least one person who did because she saved her vouchers from last year and brought them to the market this year.
I was like, what? This is from 2013.
And she was pregnant last year, so now we know she's postpartum this year. But, you know, it'd be interesting, again, to see, does she become pregnant and cycle through again?
And then the comment I had was that on occasion we never saw the mom because I was expecting that she would be pregnant and young, and sometimes it was someone else, like the grandmother or the great aunt, obviously not the mom, and so we didn't have the opportunity to get that experience, you know, to start passing that the relationship going from the mom to the child and the whole experience. So is there a way that you can ask them if they're actually going, or are they sending someone on their behalf, or can we encourage their visit?
It's not something we currently ask, but it's something we could add because for the 2014 program, we asked them, which we didn't ask the year before, is who ate what you bought? You, your kids, other family members, and I can't ever remember the fourth response in that.
Other people.
I don't remember what it says. So it would be really easy, without making it more than one page front and back, to add that question of, say, did you shop or did somebody else go with you? And
but that's a really good question. They're not able to just give that voucher to somebody else to use.
They sure can.
yeah, they can.
Even if they're not, no, that's a limitation.
I think, I just want to say, because I think we get questions about this, I want to be sure we're trying to create a program that's nimble enough. We have two different groups in mind here, believe it or not, even though we're all with these big, fat, hairy institutions. The shopper, making it as easy for them and their family to get to the market, understand the process, whether it's produce perks, produce prescription. They can go to any market, it's the same token, so make that simple. But also for our market managers, make it simple for them to understand how this program works. And I think sometimes we sacrifice the ability to have a tighter program because of those values. So asking someone to have an ID when they turn in their voucher might be a way to verify that and get them there, but we don't want to add that layer. They might have other stuff going on that they can send their mother instead of them. We'd love to be able to track tokens and see what's being redeemed that's PRx, what's being redeemed that's produce perks, But do we want another set of tokens circulating among 21 markets? That sounds kind of crazy too. So I think, for us, it's a challenge with the evaluation and impact, but also keeping this program real for the participants and the market managers. And it's something we're always kind of struggling with because we're trying to kind of balance so many different interests at the same time.
Yes, Teleandra?
So quick question. I was curious, given the population of when I looked in 2013 and 2014, I'm assuming 2013 probably slated towards African Americans, and then with the addition of the materials being translated, you were able to bring in Spanish-speaking women. So were there any kind of cultural findings that you guys discovered in terms of perception or kind of connectedness to a farmer's market type environment, and also around just the influence of how culture may influence the fruit and vegetable consumption in terms of what I eat, what I don't eat, what I'm exposed to, what I'm not exposed to, etc.
We knew she was going to ask a good question.
I love you more.
So I think you're asking about if there was cultural variation, and I'm going to answer and perhaps not. I think, as Morgan said, we're just starting to look at 2014. Okay. We had 75 moms in 2013, and so of that, about 20% were identified as Hispanic. Mm-hmm. So that's a pretty small group. But we had 175 moms participate in this past year, and I think we'll be able to look at that a lot more closely with this larger group. I think we also asked them more questions that would give us more answers. So this time we asked them what they bought. So we'll actually be able to see if there's variation in who bought what. We'll know, and we know last time, we know which markets they went to. So that, and we also asked how they prepared the fruits and vegetables that they bought. So we did that very purposefully as kind of our next step in saying, it looks like there are enough going. Let's find out what they're doing with it now, because that's what people are going to ask. So that's what we'll be looking for from last year. Mm-hmm.
Yeah, I was interested from the GIS standpoint. It showed the areas where there was the highest infant mortality, and I'm just curious if there were any differential results based on geography. Like, did you get better participation in one area?
So the question was about geographic variation participation, and I think that'll be another question we can answer more carefully in 2014 as compared to 2013. There are also some, there's a little bit of variation too in how these clients are seen. So we were also interested in the clinical visit versus the home visit, and if that would have some impact. I think we do have, we've asked the moms to provide us with nearest intersection. That's how we're getting our GIS point effectively. That's not always provided. And so I know in our 2013 data, I believe we had it for about 2/3 to 3/4 of the moms. But we can also link them to the site. So that's part of what we wanted to look at more closely in 2014 as well, is there variation by site and or by geographic location, and even with the market availability and access. Mm-hmm. Julie.
Yeah, I had a question about expansion. You were mentioning the REACH grant that's coming up in the next couple of years. Mm-hmm. And if there was a provider or a group of providers that wanted to get involved, particularly from the QHC, would you recommend they speak with you all or with people at HIPC, or what do you think? Is there any hope for them?
There's hope. There's always hope in my book.
So how could other providers get involved with PRx for hypertension? As part of REACH, we're actually working with Better Health Greater Cleveland and have identified 9 FQHCs on the east side that we'll be working with to expand PRx starting this year. But even from the beginning, our idea and our vision was what could this look like for lots of different populations, and how do we expand it? And I think it's always something that we're thinking about how to do. So
let's talk.
Yeah.
Yes.
Yeah.
Because I actually got a phone call the other day from a different hospital system saying, I want to write prescriptions for fruit and vegetables. How can I do this? And the other interesting thing that we didn't mention, but initially with the model out of Michigan, their focus was pregnant women and kids. Like, we haven't even touched the pediatric population yet, and this is also extremely popular when you look at program development out there for, looking at this as a childhood obesity prevention effort. And so the sky's kind of the limit in a way. Right now we're working within the resources that we've had to date, and so we just have to keep having those conversations.
Please keep going on. How does the Farm Bill affect this then? Do you know? Like, is this something that will be supported in the Farm Bill going forward?
So that Finney grant came out of the Farm Bill. The Food Insecurity Nutrition Incentive Program is something that was in this most recent Farm Bill, and that will be a grant that comes out annually from now on. So groups can apply for that. Now that's tied to SNAP. So SNAP is the program formerly known as food stamps. And so if we can link SNAPs and PRx, we can make that happen. I think the other interesting thing that we've been kind of keeping our eye on is this whole discussion around community benefit and healthcare institutions and hospitals. And there was a ruling by the IRS at the end of last year that they can offer nutrition incentive programs as a way to get their community benefit dollars or community benefit requirement met for their nonprofit status. So I think there's a really interesting opportunity to work with not necessarily only private foundation dollars, but hospitals and healthcare institutions to figure out ways to fund these types of programs as a community benefit. We're really excited about that possibility. I know a report just came out of some work, I think it was in Massachusetts, around this particular issue, which would lead to a more sustainable stream of funding for these programs and allow us to expand it to a lot of different types of patients and participants.
Because in the other issue, from CFHS's perspective, we're barely touching the scope of, if you're focusing just on pregnancy, we have just under 15,000 births. We're barely scratching the surface, particularly for high-risk women who and that funding only goes so far, and so we're exploring, because from CFHS's perspective, not only were we bringing the providers, we paid for all of the promotional incentive items, the printing of all the materials, that money all came out of CFHS's pocket. And when you look at just expanding within the scope of pregnancy or preconception health, that's going to take a whole nother layer on top of these incentive programs to really continue to move the expansion forward.
So this is really great stuff, and I'm interested in how there's potential difference between the group setting, like the example around the centering, and how that group or social network was a reinforcing positive versus individuals. And would love to hear more about that, or if you have some plans for perhaps examining that in the future. Because if this does indeed grow, having some strategies on the back end to help support the implementation seems like a really interesting area to focus in on. So
I'm just going to say anecdotally, particularly because I'm the one entering 700 plus forms this year, and I brought that on myself. But from the centering perspective, we know the difficulty is these women aren't enrolled in centering until around the 20th or 24th week of pregnancy, I believe. And then they're only in the centering program through their pregnancy. So like UH, for example, the Department of Family Medicine has a centering parenting program, so those moms are moving through. But if they're within the OB department, when they deliver, their program is done. So, if these moms are enrolled at their 32nd week of pregnancy within centering parenting, they won't finish the program because there's not that follow through, which is the challenge we also know we had with WIC last year is for the clients that went through the traditional prenatal model, once they delivered, they weren't coming back particularly for their WIC coupons for 6 weeks, and so there was that lag time. But I can tell you, just by the data entry for this year, the one home visiting program in particular, every single participant has a baseline survey all the way through end of season, and there's really that trust between that provider and client within the home visiting setting. And I would have to suspect, just from the stack of paper, that the other home visiting program is much the same way. Those clients followed through and just really had those conversations with their provider in a much different way than the group setting.
All right. Well, please join me in thanking our presenters for awesome If you have not signed in,
Put that next on.